Hello, everyone. My name is Mariah Cropp, a senior at VCU, and today I'm going to share my research topic titled Deeper Than Roots: Oral Health-Related Quality of Life Among Latin Adults. This research is examining how oral health affects daily life, well-being, and social functioning among Latin adults in the U.S. Periodontal diseases are common, yet they are very preventable. They involve inflammation and infection of the tissue supporting the teeth, and in advanced stages can lead to tooth loss. They progress from healthy gums to gingivitis, mild, moderate, or severe periodontitis, the stage where bone breaks down and untreated disease can result in tooth loss. In the US, Latin adults experience a disproportionate burden of severe periodontitis. 21.2% of Latin adults are affected compared to 5.9 white adults. This disparity underscores the need for focused research and targeted interventions. Periodontitis is linked to serious systemic conditions, including heart disease, lung conditions, and diabetes, and so much more. It also contributes to dental decay, gum disease, as well as tooth loss. These broad impacts make oral health a critical public health issue that requires culturally responsive solutions. To design effective interventions, we need to understand how people experience their oral health. Oral health related quality of life captures these perceptions. It reflects pain, bleeding gums, functional issues like chewing and speaking, as well as emotional and social dimensions such as how someone feels about their appearance, as well as satisfaction at work and school. Oral health related quality of life provides a holistic view of oral health beyond clinical indicators. The oral health impact profile is the most widely used tool to measure oral health related quality of life. Earlier versions had 49 or 14 items. More recently, the 5-item OHIT 5 was developed to efficiently capture meaningful quality of life information. Its brevity makes it especially useful for assessing oral health related quality of life among Latin adults. So I have two aims. Aim one is to assess oral health related quality of life among Latin adults using the OHIT 5, and two, to identify correlates of oral health related quality of life within this sample. So we recruited 189 Latin adults who self-identified as Latin, were 18 or older, and provided consent. The sample included a wide range of ages, backgrounds, and experiences. Participants then completed a survey capturing social demographic factors, socioeconomic status, and insurance coverage. They completed OHIP 5, which measures pain, function, appearance, and social impact. Total scores were categorized as low, medium, or high oral health related quality of life impact. So my M1 results: 28.6 had low oral health related quality of life impact, 51.9 had medium, and 19.6 had high. Across the subdomains, most participants reported low levels of pain, functional limitation, appearance concerns, and social impact. For aim 2, we examined whether oral health related quality of life differed by age, sex, marital status, as well as education, income, or insurance. None of these variables just so happen to be significantly associated with oral health related quality of life. For example, age had a p-value of 0.44. This suggests that oral health related quality of life challenges were consistent across sociodemographics in their groups. These findings highlight the need for culturally grounded oral health interventions, since oral health related quality of life impacts were not strongly tied to demographic or socioeconomic factors or structural barriers such as access to care, language, and insurance. They may play a larger role. Addressing these barriers are essential for improving oral health equity among Latin adults. I would now like to acknowledge my research group, Kapuli Research Group, and my wonderful PI who mentored me during this process, Dr. Garcia. I would also like to thank VCU McNair scholars, and most importantly, those who took the time to participate in the study. Thank you for listening to my study and taking the time to learn about this work. Centering the experience of Latin adults helps us to better understand the deeper roots of these health disparities and how we can move towards equitable solutions.